Good afternoon, everybody. I'm Lyric Bartholomew, a professor of pathobiological sciences and a co-chair of the advisory board of the UW-Madison Global Health Institute. And I'm here to welcome you to the Global Health Tuesday seminar, launching for this spring semester 2021. The Global Health Tuesday seminar series hosts researchers and practitioners from the UW-Madison and across the world. The speakers showcase the complexity of global health challenges and the many kinds of expertise needed to address them. By sharing their experiences with the campus and Madison communities, these guests provide insights into global health, encourage conversation, and help colleagues connect locally and globally. We'd love to see you again in February for our next Global Health Tuesday seminar when GHI Director Jonathan Patz, Pathobiological Sciences Professor Kristen Bernard, and Population Health Sciences Associate Professor Ajay Sethi look at what's new for COVID-19, lessons learned for 2021, and preventing a future pandemic. So mark your calendars for April 14th, as well when GHI hosts its annual Global Health Symposium. This year's topic is fostering resilience through indigenous wisdom and scientific knowledge. So for a few housekeeping items, you were muted when you entered the webinar, and if you have questions, please put them in the chat box rather than turning on your mic, just for bandwidth and noise purposes. We'll have time at the end of the webinar to answer your questions. So today I'm really pleased to get to introduce you to my colleague and friend, Avriel Rose Diaz, who's Executive Director of Walking Palms Global Health in Bahia De Caraquez, Ecuador. Avriel co-founded the NGO Walking Palms in 2016 after a devastating 7.8 magnitude earthquake hit Ecuador, you may remember. She's a systems ecologist with a master's degree in evolution, ecology, and conservation biology, and a focus on infectious diseases that she earned at Columbia University quite recently. Avriel and I met at an American Society of Tropical Medicine and Hygiene meeting several years ago, and we naturally connected around an interest in both mosquito-borne disease and in place-based teaching and learning about mosquitoes with kids and families. We actually have a very rich collaboration between my lab and Walking Palms and our colleagues at Iowa State University through the Urban Ecosystems Project. And in fact, our collaboration is supported by a seed grant from the GHI. Looking forward to the time when we get to go visit Bahia. We were scheduled to get on a plane last spring break, and of course, that was thwarted. So we're looking forward to the vaccine rollout and safety and capacity to get back together. So today, Avriel will be sharing perspectives on the impact of COVID-19 on the communities in Ecuador where she works. I know this audience will find many connections to their mission and experiences, and I'm sure you'll see and find some inspiration from the creative approach Walking Palms takes to global health practice and training. So welcome, Avriel.
Thank you.
Yeah.
Thank you so much. I'm really excited to be with you all today. I'm gonna share my screen now. So before we jump into the presentation, just a couple of things. I am right here in Ecuador right now, and my internet isn't perfect, so we might experience some lag, so please bear with me. Also, there you may hear some noise outside. The garbage truck may be going by and play some loud music. And that sound that you just heard is a water tank for anybody that uses water in the building. So you may hear a couple of things, so just be patient. The other thing is we're going to be talking about COVID-19. This can be triggering for some people, so if at any time you need to take a break, that's no issue at all. And I look forward to answering as many questions as I can once we end this. So I am the director of Walking Palms. We are a disaster relief and recovery organization, and we're focused on research, education, and medicine. And so we do a lot of community-based work, but we also work with stakeholders at the national level, at the provincial level, city level, and with our community stakeholders as well. And so during this pandemic, we've experienced a lot of new issues going on, and so we're going to dive into that a little bit today. So as you may have heard, Ecuador was one of the first major epicenters in Latin America. This is in part due to lots of flights coming in from Spain, Italy, the US. And we're gonna touch on a quick video from the New York Times, but we had our first case confirmed February 29th, and on March 11th, the Ministry of Health declared a state of emergency, and on the 16th, we entered complete lockdown. And so that complete lockdown was very different than much of the world. We had strict toca de queda, which means we had to be in our houses and could not leave after 2 p.m. So from 6 a.m. to 2 p.m., you could leave your house, you could go to the grocery store or a pharmacy, and you could get, essential supplies. But aside from that, you could be questioned. Where are you going? What are you doing? And the fines were severe. The first one was $100, which is 25% of the minimum wage. The second fine was a full month's pay, and the third fine, you were going to jail. So it was really intense, and we're going to talk a lot about how this impacted people in areas of education, mental health, jobs, a lot of things. So Logan, if you could play the video from the New York Times. It's a short clip. It's about 6 minutes. And I think it'll help set the stage. Not hearing any audio. You may need to click the audio on the actual video itself.
Outside a hospital in Guayaquil, Ecuador, a family seals the coffin of their father with plastic wrap.
¿Con qué resultado? ¿COVID positivo? ¿O no? Insuficiencia pulmonar. A todo el mundo le ponen lo mismo. Le ponen insuficiencia. ¿Sabe para qué? Para que digan que hay pocos muertos de COVID.
Many people in Guayaquil blame the government for failing to slow the spread of coronavirus and to deal with the thousands of bodies that have piled up in the aftermath. Guayaquil has suffered arguably the worst COVID death toll in Latin America. The thing is, Ecuador had acted earlier than its neighbors to close borders and order strict quarantine. So what went wrong?
El Ecuador se infectó cuando vino la primera contagiada.
Tenemos más de 3 días llamando a esa verga.
From the start, the 1-2 punch of rapid contagion and the ensuing death toll caught local and national officials off guard.
Tenemos el primer caso confirmado de coronavirus en el Ecuador.
On February 27th, doctors in Guayaquil diagnosed the country's first COVID-19 patient, Bella Lamia, a 71-year-old retired teacher, otherwise known as Patient Zero.
She was living in Spain. She came through the Guayaquil airport and she drove through her hometown.
Dr. Esteban Ortado is a medical investigator helping to advise the government on the pandemic.
And in her hometown, she visited all of her relatives. She went back to Guayaquil and found medical services in Guayaquil in a private service clinic. She got really bad. She got in the ICU unit. 5 days later, she got the diagnosis. So 2 doctors from that first clinic got also positive because nobody knew about it.
It took 13 days to diagnose Lamia with coronavirus, and in that time, she infected many other people, including much of her family, pictured here in 2019. In all, 3 family members died, including Bella herself.
She totally infected 17 people confirmed, but we know that the culture in Ecuador, before getting the diagnosis, could spread the virus more. We lost track right there.
After she arrived in Ecuador, Lamia stayed in the home of her niece, Cassandra, in the town of Babahoyo.
Ya nunca supo qué enfermedad tenía. Y hasta ahora muchas redes sociales nos apuntan como si mi tía fue la culpable de que el virus se propagara acá en el Ecuador.
Bella Lamia was certainly not the only case. There were at least 6 other flights from Madrid to Guayaquil between the time she arrived and when she was diagnosed. Other travelers later tested positive for COVID-19.
Ella nos contaba que en el avión ella le había dado fiebre y que mucha gente venía tosiendo en el avión. Una vez de que ella ya llega al aeropuerto, no existieron por ningún lado los protocolos.
And that was the first problem. We didn't track very well the entrance of people from the airport. So in the first 2 weeks, most of the patients came from the airport.
Those lost weeks led to an out-of-control epidemic. 2.5 weeks after Bayalamia's diagnosis, the country was on lockdown. 2 weeks after that, Guayaquil was in the throes of the most aggressive outbreak in Latin America.
It is true that at the very beginning it was a disaster. We're learning by mistake, by errors that we made.
This is Dr. Juan Carlos Ceballos. He was installed as Ecuador's health minister in late March, after the former minister resigned. He admits the government should have tested and tracked patients, but he also blames residents for not following stay-at-home orders after Bea's diagnosis.
Ecuador, as I said, was prepared. I mean, did all the measures that in place and very early. Unfortunately, the people didn't hear us and they did not obey those restrictions.
Like a lot of cities in Latin America, a large segment of Guayaquil's population lives day to day working in formal jobs. So to stay home means not eating. It was a perfect storm of factors that left Guayaquil's hospitals and morgues overwhelmed. Now the government of Ecuador has another dilemma: just how to bury the thousands of bodies that have piled up in the weeks after Lamia's death. Ecuador's official COVID death toll is several hundred, but forensic police have been working around the clock to collect and account for thousands more dead. And construction is now underway for various large burial sites around the city. Container trucks like this one transport corpses to one new site on the outskirts of Guayaquil, in the neighborhood of Pascuales. Local residents, fearful of contamination, are outraged. Officials in charge of handling the dead have promised that each body will have a separate resting place. We attempted to film drone footage of the new burial site, but Ecuadorian soldiers ordered our team to bring the drone down and temporarily confiscated our footage. A human rights worker documented the incident.
Vecinos han denunciado el ingreso de tráiler al menos 3 veces al día con containers llenos de cadáveres supuestamente a este cementerio donde habría una fosa común.
Since the first coronavirus diagnosis, distrust of the government's handling of this crisis appears to have spread as fast as the contagion itself.
Okay, so I wanted to show you that video to basically preface what we're going to dive into. So today, right now, the government has confirmed 241,000 cases and about 15,000 deaths. And as you can see from this map, you can see the hotspots. Manabi is the province that I'm located, and I'm located right around here. And so we are one of the areas that the coast was really affected because this is where tourism goes to first. Quito, the other major city, is in the province of Pichincha, was also highly affected because that's an airport location as well. And so that initial outbreak just hit the coast tremendously. So the other thing that I wanted to show you, that there is severe underreporting. You could see in 2019 and 2018, the total deaths from January to September range about 55,000. In 2020, it was about 90,000. A lot of the hospitals were not reporting initially, still are not reporting. And there was a lot of misreporting as lung infections are unknown. And so this was part of the reason why there was so much mistrust with the government, because of the underreporting, when we could see how many people were really sadly dying around us. And that was hard because you don't want that kind of misinformation being shared. So I want to talk a little bit about the vulnerability of the population. So as we all know, COVID affects, different populations differently depending on your socioeconomic status, where you live, and how much access to resources you have. So we're going to talk a little bit about how we can reduce disasters by focusing on target populations that we need to target and put more resources towards. So the first thing is that vulnerability can be evaluated by assessing exposure and sensitivity. So exposure refers to contact with specific entities. For example, are you in contact with somebody that's COVID positive? And sensitivity refers to the capacity to experience that harm. So do you have access to running water? Do you have access to go to the hospital if something happens? So exposure. The big thing that happened were people were traveling to Bahia. This is the location that we're based in, from Guayaquil and other regional cities. And a lot of those people were international travelers. And then once the virus was here, it started spreading throughout the community. And so one thing to note is that in lower income neighborhoods, people are living in close proximity and in very humble homes where you have 1 or 2 rooms and you can have up to 7, 10 people living in an area. So preventing the virus is extremely difficult if one person gets it. There's no option to isolate a family member. And a lot of people had loved ones that are working in an essential business or at the hospital. And so there were no extra areas that you could go and isolate in. I know that in the US, lots of our doctors were able to go and stay at a hotel, for example. That was not an option here. So sensitivity. So here are a couple of things we'll be talking about, and big factors that really kind of created this explosion of events. So pre-existing health conditions. In a lot of the communities we work in, we have high levels of hypertension, diabetes, chronic kidney disease. And, we know how dangerous it can be with those that have pre-existing health conditions. And so when you don't have access to control those, it becomes even more out of hand. And so that goes into my next point right here, which was transportation. Because of the extreme lockdown, there was no buses, which is the main method of transportation, and taxis were also rare. Taxis were afraid of picking up clients were afraid of going into taxis. And another thing was the strictness of everything was that even license plates, like you could only go out once a week, and you could only go based on the last 4 digits of your license plate, and you could only go for 2 hours. So things were very strict getting supplies. Climate was another issue. We experienced an extremely hot and extremely dry season. And so lots of people that relied on agriculture lost all of their crops, and that was horrible. And then there were lots of incidences of people collapsing from heat stroke and heat exhaustion, trying to get essentials or visit the hospital because they didn't have methods of transportation. So then I want to talk a little bit about mental health. And so isolation, like we're seeing globally, has affected so many people. We've seen higher levels of depression. And particularly here, I want to talk about the elderly and those family members. The elderly relied on family members or neighbors. I'm sorry, 1 second. I have let me read that. Okay. So basically with the elderly, if you had a neighbor that was elderly, the communities were pulling together to make sure that nobody went unfed, that people had access to medicines. But it got harder and harder for those that really didn't have a great support system. Domestic violence went through the roof. People were put in close quarters with abusers, and you also had a breakdown of the offices. So because people were working remotely, there was breakdowns in reaching child protective services, human rights. A lot of the safe havens for women were closed down and they were not accepting. So this became very difficult. Extreme heat and, like I touched on, was really difficult, increasing amounts of stress, heat rashes, just exhausting to be in 95-degree weather in your house and you can't leave. We saw an increase in mosquitoes, and we'll talk a lot about that in a little bit. And then there was limited access to internet, television, phone. And you can imagine not being able to leave your house, no internet, no air conditioning, you don't even have a book. I mean, we started seeing levels of depression and suicide that began to skyrocket. Food was a huge issue here as well. There was many supply chain disruptions from the lockdown and getting things into the cities, the smaller cities, especially getting those in rural areas. 65% of Ecuador works day to day, so many people lost all of their income. And there was tons of interruptions to water. And this was huge because we're in the middle of a public health crisis. The main thing you could do is wash your hands. And so people could not wash their hands, wash dishes, flush the toilet, take showers, wash clothes. And this became huge as well. The government in Manabi were able to provide 75,000 rations of food to the province. And a lot of the communities relied on private donations and food sharing programs. And I could see clearly in my neighborhood too, people would trade and, you know, everybody was looking out for each other, which was really inspiring. The impact on nutrition, that's tough too, because when you have, you know, limited funds for buying food, you're going to go for things like rice and plantains and less protein, veggies. And so, you know, as your nutrition goes down, you become more susceptible to getting sick. Education has become also extremely challenging, like most of the world. Bahia has school from May through December, and then through January to April, there's a vacation. So we were completely postponed. There was no talk about it, just like many parts of the world. So the Ministry of Education created a remote learning program. This is an issue because in most of the area, it's really hard to access internet. So they created a program that uses WhatsApp. WhatsApp is a messaging platform that most of the world uses. And so the students would receive their assignments from their teachers for 2 weeks worth. And then they're expected to download the assignment and print it and complete it and return it. This is really challenging because a lot of the students don't have internet service or phone service and or supplies. So, you know, something that we take for granted, having pens, pencil, paper, a lot of the students that we work with, they don't have that. And so many of the students couldn't complete the assignments that they were given. On top of that, a lot of the parents of the students that we work with are illiterate, and so they couldn't guide their children through the assignments that they were given. This puts frustration on the parent and on the student as well, and it was something that we'll talk a little bit about later of what our organization is doing to try to combat that. Families that can afford it have started like education learning pods. So you'll have like 5 students in and they'll complete all of the homework together. So vector-borne disease. So in Bahia, we are in a dengue endemic area. Dengue virus is transmitted through Aedes aegypti mosquito. And we had a lot of issues here because we have a strong vector control program usually, but during the pandemic, all of the funding was allocated away from vector control and to emergency response for COVID. There was limited knowledge to spot the difference between dengue and COVID. So you had a lot of community members thinking that they were sick with something that they weren't, or having co-infection, which was extremely dangerous. There was a lot of mistrust and fear about letting vector control come into the house to do fumigating and putting larvicides in water tanks. And no one wanted people coming into their house to potentially infect their families. The other thing was that because it was that there's a lot of water interruptions, there was hoarding of water to make sure that you had something. And while you're hoarding water, these create big breeding sites for mosquitoes. And so we saw an uptake in that. We created this new way to get the program that we run with University of Wisconsin and Iowa State out. We created an at-home version of the program, and this program is called Mosquitos y Yo, Mosquitoes and Me in English. And it's an ambitious science program that we collaborate on, and we really, like Lyric said, we were supposed to have the team come out, but that didn't happen, so we created an at-home version. And so children and their parents learn about vector-borne diseases, but through a creative, fun way, and also learn about the scientific process. So this, worked twofold. Students were receiving education and also learning about vector-borne diseases and how to prevent dengue. And you could see one of our students creating a little mosquito there. Communication systems. So the internet services are really limited in rural areas, and data, is also spotty. And so with limited income, many people don't have access to cell phone plans either. And most of the information was coming through cell phones. And so there was a lot of misinformation going around, a lot of information that just was not being told to people living in rural communities. And this led to a lot of confusion about what to do when you're sick, that the hospital was completely overfilled, and so you shouldn't go to the hospital if you have symptoms. This led to a lot of people dying in their homes. It also greatly impacted a lot of people that had pre-existing conditions like cancer, or needed to seek out dialysis treatments. And so they were also not getting the treatment because they didn't know what was going on in the hospitals. One interesting thing to note is that our trash services here, like I mentioned, they play music when you go around, kind of like the ice cream truck coming. But the government created a new initiative to put COVID information instead of the music. And so that's how a lot of people in urban and peri-urban communities received information about who to call. There's a national phone number to report symptoms and to get some information that way. However, that doesn't operate in rural areas, which usually are burning garbage. So basic resources, PPE, just like most of the world, once the pandemic had first started, we weren't prepared here. Lots of shortages of basic medical equipment, and panic. The grocery stores were emptied very quickly, and we didn't have masks or different face shields, and that was extremely tough. You saw people using garbage bags and tying shirts around your mouth and nose, but it got to the point where it just became very dangerous for the healthcare workers, like most of the world. So with this, using measures of exposure and sensitivity, the highest risk groups that we have are low income, elderly residents, families living in crowded conditions, and adults and children with pre-existing illnesses. This picture is of us delivering the Mosquitos y Yo at-home packets. So you would get your kit every week or every 2 weeks, and then we would explain it. This takes a lot of work to go up. You're walking up large hills and trying to maintain your distance and making sure that families that can't read understand how to go about and do the kit. So it takes a lot of time and effort, but so worth it. So we have these 4 programs that have been going on during the pandemic and were more of our emergency response and leading into our recovery response. And so I wanted to talk a little bit about them. So the More Than Food program that we developed was able to get out about 40,000 pounds of food and supplies to the community members that we work with. And in it, we had educational materials. We had materials using graphics on information about COVID. We had mental health pamphlets. We had children's activities. We had soap, cleaning supplies. We had a big mask production, and then lots of food staples. And those were given out to all different families, and then focusing a lot on seniors that really didn't have any kind of support system. I already talked about the vector-borne disease education program that we ran. And we also, in the bottom hand corner, you can see these packets. So our chronic disease program allowed us to get out medical supplies to our patients. So when the pandemic hit and the hospitals collapsed, so did medication distribution. Ecuador gives out free medication to anyone that comes to the clinic or the hospital. And we had a severe insulin shortage. And so we were able to work with an endocrinologist that usually comes down for brigades from SUNY Upstate Medical, and work to make sure that people continue to get their insulin and control their diabetes during the pandemic. And then the education program that we have, it's called Armonía y Salud, Harmony and Health. And that program focuses on making sure that the kids are doing their schoolwork, getting that done, but they're also doing botany, art, gym, and a lot of other fun activities. And again, this is really challenging, working in education, working with kids. The program is all outside, masks, but it gets tough, like trying to work with kids from 7 to 11 years old that don't want to wear a mask and don't understand what's happening. And then also understand what's happening too, but it's challenging. So I wanted to play this video. So Logan, if you could play it. And the video is to show kind of what it looked like when we were out doing the food distributions and supply distributions. So you could see from the video, the rural landscape. We worked with the government. We worked with the National Emergency Response Team. We worked with lots of community leaders, lots of community members. And that was pretty amazing to see it all come together. It's not easy work. You're climbing giant hills. You have to wear at that point, everybody had to wear the full biosecurity suits, and it was hot out, making sure people got hydrated. And yeah, so we are working right now to transition into recovery mode. And Bahia now has some more testing. It's not great yet, but we're getting there, and trying to still figure out how education is going to come back for the next school year that's going to be starting, and how to keep moving forward. And the mayor really did a lot to put into place for future disasters. So that was really great. They have a pretty big plan that they've rolled out. And I think that's about it. So let me share this last part. So thank you. I think we have time for questions. And here's some information if you want to learn more or get involved. So yeah, I'll take any questions now. Don't be shy.
I was wondering if you want to talk just a little bit about the work that you do with Walking Palms to bring trainees down from different universities, the kind of experiences you offer students.
Yeah, so this summer coming up, we have fellowships, research fellowships that work in any different programs that we have. This could be public health based or research based, and that is a longer period. Now we're doing remote fellowships. We had a few students last summer help us with this food distribution program and evaluation, and right now we're publishing that in the Lancet. And we have some more COVID projects coming up. So if you're interested in working with us, we do vector-borne disease research, we do climate research, we're going to be doing some permaculture work. We have a lot of projects, so shoot me an email if you're interested in learning more. Okay, how do you work with the government and other stakeholders or groups with similar initiatives? What do those relationships look like, and how are they maintained? That's a great question. So these stakeholders that we work with, we've built relationships with them since day one after the earthquake. Whenever you're working with stakeholders, it's really important to maintain that connection with them. All of the work that we do always involves stakeholders. And so it's all co-creation with communities and then local government to make sure that everybody's voice is being heard at the table. Otherwise, programs don't work and they wouldn't be long-term. And so maintaining those relationships, it's really important to have in contact, like physical contact. Unfortunately, this has been a lot harder, but working in Latin America, it can get really difficult to do like video call meetings and so forth. So a lot of it is done in-person meetings. Now we're adapting. We still have some socially distanced in-person meetings, but having those connections is really important, and making sure that once you start a project that you're following up. You don't ever just do a project and then there's no follow-up, but that make sure that the stakeholders are involved throughout the entire process. Okay, next question. Has the pandemic shifted any part of Walking Palms' vision or strategy for the long term? If so, how? I think that is really important also. We had a few different projects that we were doing before, and we transitioned from emergency response to recovery, and we did that with the earthquake, and now we're doing it again with COVID. I don't think the long-term vision has changed, but definitely our response has had to change. For example, the education program, we're also doing a nutrition program now. And so we've definitely seen a switch in what projects are needed in the now. And again, those come from the communities. And so whatever the communities are suggesting, and also local government, that's where we kind of focus, but with a long-term vision towards recovery. Are there any changes you implemented due to COVID that will continue? Yeah, so we have really strict protocols, and that's been challenging, although we're adapting pretty well now. Every team member, we have about 20 team members, and so everyone has to follow like this very strict protocol to make sure that everybody's staying safe and all participants are staying safe. We've also been working from home more when we're not in the field, so we'll probably continue with that and then get together when we need to. What is the current COVID situation in Ecuador? Yeah, so the current COVID situation is that the airports are open. There were talks about closing it down again when the new strain was introduced, but that hasn't happened. We are out of lockdown, and for the holidays, we did have a 30-day period of emergency state where we had those strict curfews again, but right now things are going back to normal. There's still a mask mandate. You cannot go into any public area without a mask, and that's been really important. Okay, a lot of questions are coming in. I'm liking these a lot. As people were at home during the pandemic, is there any data on the increases of vector-borne disease? So right now, that's actually one project that we're looking at. And so we're working with the Ministry of Health to get that epi data. And from talks in the community, we do a lot of qualitative work also. It does seem like there were more cases, but that's something that we're waiting for. To get a hold of this data was slow before COVID, and now because all efforts are focused on COVID, it's really hard to get that. But that's what we're in the process of right now. Thanks so much for the talk. I'm wondering about successful strategies for long-term funding for public health measures after the immediate crisis is over in resource poor settings, and how do you keep the momentum going? Yeah, so when the outbreak hit, we did see a surge in donations. People want to help, of course, which is great. And right now we're looking into grant writing and also having long-term donors and larger private donors, and some other bigger organization that gives, you know, larger grants for 5 years at a time instead of, you know, constantly soliciting donation campaigns. What role will Walking Palms play when the vaccine begins to roll out? Yeah, so we hope that we will be able to help with some of the distribution process. I think that it will take a bit to get it here to Bahia, since we're a smaller city. And so it'll be a while, but we're hopeful that it'll get here soon enough so we can start doing that. And the morale is that people want the vaccine here, so that's great. How did you get involved in this work? Okay, that's a fun one. I was invited to south of Ecuador, and then the earthquake happened. And I worked in a medical clinic in the north of Ecuador, where we ended up doing some Zika research and dengue research. And then with my co-founder, we started seeing all the different health disparities and how long it would take to recover from the earthquake. Many people think, like disaster response happens and you're there for a year, there's a lot of effort, but eventually many organizations go away because they're there for the disaster, not there for recovery. And so I wanted to build an organization that focused on long-term sustainable recovery. You mentioned that there was some COVID testing. I'm wondering where the closest clinic is for testing and what type of testing is being used. So we have 4 clinics for testing, and 2 are private, and then 2 are government. There's also brigades that go out, and you'll go out to communities and then the line will form and they have rapid tests for that. There are PCR testing at the private clinics, but that's really expensive. It's about $70 and most people can't afford that. So a lot of it is based on when the government comes and does the medical brigades. I'm with the Seba Foundation. We also did food distribution for small rural communities in northern Manabi. Oh, between Bahia and Verde Mountains. And I'm more recently working in an area of conservation in 4 countries. Have you collaborated all in this effort down there? When would you be interested? I would be very interested to collaborate. Send me an email after. That'd be great. I think those were all of the questions. I think I answered all of the questions. And if anyone has questions afterwards, please feel free to send me an email and I'll get back to you. But we love to work with new collaborators, and having the research fellows has been really great. So please see reavailability of vaccines. I don't know what that means. So yeah, if you want to message me after, that would be great. Thank you for listening. I think it's so important to get the story of what happened here. I had one of the first cases in our area, and it was really interesting to see how COVID played out while having COVID. And there's a lot I could talk about and go on. So any questions? Just oh, one more question. What is the current thing you see that is helping decrease the spread of COVID, while also bringing the community together? I think that the lockdowns, of course, prevented a lot of spread, and now people wearing masks and still maintaining distance. There's also a lot of, still you can't have more than 10 people in one. But there's a lot of strict measures in all of the supermarkets and the mall as well. And in terms of the community coming together, a lot of communities during this time took the time after we were allowed to go outside to clean up their communities. And there was lots of donations of paint and materials. And so the community started to look just so beautiful. And they're called mingas. And that was really, really cool to see. Thanks, Sarah. Are you facing the same anger about face masks, lockdown, social distancing this year? No, that's completely different. The mindset here is definitely wear a face mask, and people get upset if people aren't wearing face masks. And a lot of the times it's because people are forgetting where it drops below the nose, but it's not what's happening in the US. Social distancing, of course, people want to get together with their families. That's one thing that I think globally, everybody is so tired, you know, people want to hug their grandparents. But there's still good social distancing being maintained in a lot of space. And because it's warm out, you know, most of the restaurants here are outdoor restaurants. And so that helps tremendously. So for vaccine supply, I think that we will be waiting for quite a while before we have that available in Bahia because we're a smaller city. So I think Quito, Guayaquil, those will be the first cities to start getting vaccinated, and it will go to frontline workers, hospitals first. Wasn't the Guayaquil area hit particularly hard? Yes, Guayaquil was, it looked like a scary movie, to say the least. There was severe outbreak and a ton of issues. And there wasn't morgues available, and there were literal dead bodies being lined in the street. This is extremely traumatic. So not only could you not attend a funeral, but your family member was not being picked up from your house and bodies were beginning to rot. It was a huge public health crisis. Any other last questions? I will say, just to end on this note, that the government shutting down so severely in the beginning, I think prevented thousands and thousands of deaths from occurring. We didn't have ventilators. Our city received 3 ventilators, and that was going to support over 75,000 people. So we don't have the resources here to remain open in a crisis like this. So they did a great job making sure that things were shut down quickly and efficiently. And then, you know, they tried to make sure that food rations were given out, but it was just really challenging. Yes, the vaccinations will be free is what I'm hearing. How far were you from Guayaquil? We are about 4 hours by car. Fly next to me. Any other questions? All right, so with that, thank you very much for being here today, and I was really excited to be able to talk to you. If you have any information, just email me.
Thank you so much, Avriel. It was great to see you and hear the story.
You too.